Hi, welcome to Starkey at a Glance. I'm Phil Nelson, Product Specialist and Sales Support at Starkey Australia. Today we will be talking through infection control. We're going to cover what it is and why it's important. We're going to talk about disease transmission, protecting ourselves and others, as well as some helpful tips for the hearing healthcare practice. Today we're going to be covering what is infection control and why we should care, disease transmission, protecting ourselves and others, as well as some helpful hints for your hearing healthcare practice. So what is infection control? Infection control involves developing and implementing a consistent set of procedures designed to reduce the potential of cross-contamination in the audiology clinic. It's a process where we assume every microbe is potentially infectious and has the potential to make your patients, staff members, and clinicians sick. It involves controlling not only exposure between people, but also between people and their environment that they're in. Although it's not a new concept, obviously in the current situation with COVID-19, infection control is a hugely important thing in helping to manage the spread of the virus. The concept of viral has taken on quite a different meaning in the recent months, weeks, and days. Humans are now more mobile in their communities and can travel so readily and easily, more than they ever have been able to before. So disease really has no borders. In the past, outbreaks would often be confined to a geographic area, but today the infectious microbes, they can travel with us as we travel from one side of the world to the other. And you might not know that the patient in front of you has come from a region that's at more risk, whether that be internationally or another region within Australia. Infection control has obviously been around for a long time, especially in the healthcare community. And with the current situation, I think we're all aware of the urgent need for not only us as the healthcare professionals, but every individual in the community to maintain stringent infection control protocols to help guard against the transmission of the infectious disease. So why is it so important in the healthcare sector? Behaviours that we often use in the clinic, such as shaking hands with patients, those sorts of things are areas where we need to stop doing that to try limit the spread. I'm going to show a quick video which demonstrates how easily diseases can be transmitted. So this is just a typical kind of day in a hospital. Obviously, you've got your doctor and a patient there, patient being in for a consult. So this is just what if bacteria were not invisible. So you can see the green paint on there is trying to simulate the microbes, the infectious microbes. You can see they're now all over the doctor's hands, all over his lab coat that he's wearing, as well as on his stethoscope. So now everything that he's touching is going to end up with those infectious microbes on it. You'll notice that he hasn't washed his hands as he's left the consult room. Goes to get gloves. You can see that that's now spread onto the box that the gloves are in, and through his workstation as well. So every little thing that he's touching now is a potential area where someone else could pick up those infectious microbes. Goes out and shakes the hand of a colleague. Now she's going to spread that around too, and then goes to see a patient. So just really highlights how important it is to practice proper hand hygiene. So why is infection control important for hearing healthcare? As we already know, there's numerous comorbidities associated with hearing loss. many which fall into the category of high-risk individuals and the senior population. And while they're not the only at-risk category, the seniors are certainly one of the most vulnerable. Factors that make the senior population more predisposed to infections are things like their impaired immune function, anatomic and functional changes, and the degree of exposure to infection. Their compromised immunity, the anatomic changes such as thinner skin, functional changes such as the loss of body mass that are commonly seen in the elderly, all contribute to their frailty, which in turn increases their risk of falls as well as injuries. The environment of the elderly can really influence their exposure to infections. So if you look at those that have spent time in long-term care facilities and hospitals, or those suffering from dementia, they bring a greater risk than those living in their home environment. And they may be like an unwitting carrier of disease from their home environment into your office. And the nature of our jobs and the population that we frequently serve, being the elderly, puts the burden on us as the hearing care professional to be educated and prepared to protect ourselves, the staff, and the patients that we see as well. So how's disease transmitted? There's 4 modes of disease transmission that we're going to cover. That's contact transmission, vehicle, airborne, and vector-borne. So contact transmission is the most frequent mode of transmission and refers to the potential spreading of disease by the way of touching or coming into contact with infectious objects. The contact transmission can be divided into 3 subcategories. The first is which is direct contact. So that's direct contact transmission involving exposure to microbes via direct contact without intervening persons, barriers, or conditions. So essentially just touching things that are out in the environment where the microbes might be sitting. The second subcategory is indirect contact, where the microbe is transferred from a secondary surface to an individual. So an example of that might be with otoscopy, or if you're listening to a hearing aid with infectious microbes on it, and then without cleaning and disinfecting the listening piece, using that to then check another hearing aid, and that's obviously indirectly being spread. And the third subcategory is droplet contact, which refers to the transmission of infectious microbes through particles that are expelled by coughing and sneezing. Those infected particles land on a surface that is then contacted by a susceptible individual. So an example of that, you might have a patient coming in through your door. They might sneeze as they're entering, get that over the door. Your next patient comes in and then they use that. They open the door and then they've now got that on their hands. Vehicle transmission refers to the potential spread of disease through contaminated food, water, or bodily substances, such as cerumen, which is obviously a very relevant one for us, which we will cover a little later in the presentation. Airborne transmission, which is the transmission of disease through the air via droplets or particles. So now you could be walking along, someone walking the opposite direction, they might do a big cough or a sneeze. Those particles go out into the air and then you happen to breathe them in. So one of the reasons that we have the social isolation and separation with the 1.5 meters is to try avoid this method of transmission. Vector-borne transmission is just the spread of disease where insects or animals transfer pathogenic agents through contact with a susceptible host, but not really relevant for the current COVID-19 situation. The most common ports of entry for infection in a hearing practice are the eyes, the nose, the mouth, and the ears. And of course, the ear is our main focus for us in an audiology clinic. So we're going to cover that in a bit more depth. So the external ear canal is more prone to infection than any other skin surfaces. Although the cerumen's role is to inhibit microbial growth, its effectiveness can be challenging for hearing aid wearers or those that are wearing hearing protection, using like earplugs for mobile phones and iPods. People that do consistently occlude their ear canals, it creates a darker, more moist environment in the canal. And as the canal is retaining more moisture, the ear canal's pH level changes to a more neutral or alkaline level, which makes it more conducive to bacterial and fungal growth. And if we think about the concept of hearables and even the use of mobile phones, there's an ever-expanding array of devices that have close contact with the external auditory canal. Cerumen's role is to inhibit microbial growth and impede foreign objects from invading the ear space. It's not an infectious agent per se, unless it becomes contaminated with mucus or blood. The typically dark colour and the viscosity of cerumen make it really difficult to distinguish the presence of those bodily fluids. So for that reason, we should always treat it as an infectious substance, because we really can't determine the content of it just by looking at it. Obviously, cerumen is extremely common in an audiology clinic, so all hearing care professionals should be utilising universal precautions when we're exposed to that substance. Infection control is a critical issue in an audiology practice for several reasons. Obviously, the nature of hearing aid fitting and hearing tests predisposes both us as the professional and our patients to numerous potentially infected microbes. In addition to that, like hearing aids and ear molds are known transmitters of microorganisms. They might be harmless to some people, but deadly to the immunocompromised individual that could well be the patient sitting in your fitting chair. Microbial growth that's found on the hearing devices represents a critical infection control concern. And obviously with the increase in accessories that are getting used, as well as smartphone technologies, the number of items that make up hearing products continues to grow, as is their potential to spread disease. Dangerous surfaces lurk everywhere. Things like your mobile phone, currency, credit cards, and even the clothes that we wear have the potential to be harboring infectious microbes. So we really all need to use universal precautions. So first one of those is personal protective equipment. Using gloves, glasses, masks, and gowns whenever there's the potential for exposure to infectious agents. Hand hygiene, as has already been mentioned in here and will be mentioned again, is very important. Washing your hands before and after every patient, and before and after putting gloves on and taking them off. Cleaning and disinfecting surfaces. So any surfaces that are touched or that get splashed on really need to be cleaned regularly and disinfected. Critical instruments used need to be sterilised. We need to make sure that infectious waste is being disposed of appropriately. So in the audiology clinic, glasses, masks and gloves are really important protection when doing like ear mold and hearing aid modifications. And you should also consider using a gown if you're working with materials obtained from a known infected individual, or if you're in the presence of known infectious agents. Gloves should be worn in the clinic if there's any open wounds or visible blood present. When you're cleaning or disinfecting instruments that are contaminated with bodily substances, submersion or removal of instruments into or from cold sterilant. And if your hands are likely to become contaminated with potentially infectious material, obviously including cerumen. One very important thing to note is that gloves is not a substitute for clean hands and hand hygiene. As I've already said, you should be washing your hands before putting gloves on as well as after taking the gloves off. When you're wearing gloves, they should fit nice and snugly across the fingers, the backs of the hands, the wrists, and the palms. And they should be nice and close and tight on the skin. Audiometric and lab areas or repair areas should be equipped with gloves, and they should also be easily accessible for those that are cleaning surfaces. The gloves are only designed to be used once and then disposed of, as the improper use of them can result in some cross-contamination. As we're reminded daily, hand washing is the most effective way to protect ourselves from the spread of disease. Soap and water is the recommended method. However, the use of hand sanitizers that contain at least 60% alcohol are also an acceptable substitute, especially if soap and water isn't available. When you're washing your hands, the technique and the thoroughness is key. You should be washing your hands for at least 20 seconds and making sure that you get right in between all of your fingers. One of the things we really need to do to help reduce the risk of infection for ourselves is minimize touching our faces. So touching around your eyes, your nose, and your mouth, unless you've just thoroughly washed your hands. We also need to consider using barriers between our fingertips and surfaces, or being creative and using other body parts to open doors. And, you might, for example, use your elbow to push the button in the lift to select your level that you're going to, things like that, just to help us to protect our fingertips from that exposure. Cleaning and disinfecting surfaces. Any surface that's been touched by staff and patients needs to be cleaned and disinfected with the appropriate solutions. Those would be like a liquid disinfectant, a spray, or disinfectant wipes that are obviously all of a hospital grade. In the audiology clinic, non-critical items can be disinfected, and that would include headphones, ear molds, other instruments and surfaces that are not contaminated with bodily fluids. You need to sterilize critical instruments. Now, critical instruments are those that do come in contact with bodily fluids. And to sterilize them, you either need to use an autoclave, or more commonly in an audiology clinic, cold sterilization, which just involves soaking those instruments in an approved solution for whatever length of time has been specified by the manufacturer to ensure that they're sterilized properly. Make sure you're protecting yourself and your patient during typical procedures, like ear mold impressions, fitting hearing aids. When your patient is handing you hearing aids for a clean, things like that. Hearing aid listening checks, real ear measures, ear mold and hearing aid modifications. So what you can do to be ready. Best thing to do is obviously follow government recommendations. As well as any recommendations from your governing bodies, for example, Audiology Australia and the Australian College of Audiology. They're regularly updating their websites to provide the latest information in this situation that can change so quickly. Also a good idea to monitor your state recommendations. As you know, some states will have different recommendations in place. Also ensure that all of the staff understand the plan that your office has around COVID-19, and that they can all implement that plan to help protect themselves, the patients, and as well as the clinic. So some helpful tips: minimize contact and disinfect and wash your hands again and again. Minimize physical contact. Keep doors open where possible so that obviously people can come in and out without having to touch the door. Minimize any sign-ins and use of community objects such as pens, and reduce the surfaces that need to be touched, and make sure that you're disinfecting those surfaces that are being touched. Minimize human face-to-face contact as much as possible. In your clinics, implement phone screenings. When someone calls up, work out if they really need to come into the clinic in person or whether their issues can be handled virtually, so like over the phone or a telehealth appointment. Focus on supporting current patients and consider scheduling new non-urgent patients at a later time. Obviously, you're going to have some patients that do need to be seen in person. So when you do have those, ask them questions. Do they have a cough? Do they have a fever or shortness of breath? If they do, they really should be seeing their primary care physician or their GP. Have they had close contact with anyone, including healthcare workers, that are a confirmed case of COVID-19 within 14 days of that person's symptom onset? And have they returned from any other country in the last 2 weeks? If they have, they should not be coming into the clinic. It's also important that you screen yourself and staff at your clinic with those same questions. And if any of you or the staff answer yes, you should not be going to work and should not be interacting with any staff or patients. Embrace telehealth. With the government recommending only going out for essential services, we really need to look at how we as their healthcare providers can embrace inventive ways to provide essential services for our patients while minimising the face-to-face contact. The Hearing Services Program has been regularly updating the requirements for certain appointments to allow telehealth services under the program. So make sure you're checking out their website for the latest information so that you know what you can and can't claim for. If your location of the clinic is conducive for it, see if you can offer a drive-through service for things like hearing aid repairs and those sorts of things. That way the patients can stay in their car and you're keeping people out of the clinic, which is the best thing that we can do at the moment. You want to minimize waiting room time. So in your clinic, try schedule in-person visits in a way where you minimize the amount of time that they're in that waiting area, and make sure you're disinfecting the touch surfaces in between patients. Be available. So communication is so important in these challenging times, and our patients need to be able to access news reports so that they know what's going on, like now more than ever. Social distancing means virtual communication, so phone and FaceTime, and ensuring that they can hear when they're using those methods. Even if your office is closed, your patients will be grateful to be able to access you for advice, and obviously support each other. It's a time to be creative and come up with creative solutions that can help us stay safe while supporting our patients. And you need to communicate your message. Add a COVID-19 message to the website and your social media things. Like if you're offering a curbside service, if you're offering remote and telehealth services, if you've reduced hours, put that information up there so people know how and when they can get support, as well as informing them of what infection control procedures and cleaning protocols you have in place to make them feel safe in your clinic environment should they need to come in for those appointments. And obviously, protect yourself. Beyond washing hands, make sure you're covering your mouth and nose with a flexed elbow or tissue, not your hands, when you're coughing and sneezing. Refrain from touching your face to avoid that germ transfer to eyes, nose, and mouth. Make sure you're cleaning and disinfecting frequently touched objects and surfaces. Refrain from using co-workers' phones, desks, offices, computers, and any other tools that you use in your workplace. And if you yourself are a high-risk category for complications, make sure you speak with your manager about ways to protect yourself, or whether you can look at altering your work assignments. And obviously, eat healthy, stay hydrated, get plenty of rest, exercise, and try relax. So just to recap, today we've covered what infection control is and why we should care about it, disease transmission, ways to protect ourselves and others from infectious disease, as well as some helpful hints for your hearing healthcare practices. Thank you for joining me on Starkey at a Glance. To find out more about this or another topic, please feel free to contact us on 1800 024 985 or contact your product specialist. Thank you for watching.